and welcome to our virtual job fair. And I'm so excited to have this beautiful lady with us this morning, Dr. Ware from Premier Dental Arts on Thomas Johnson Drive in Frederick. And I will let you know, we as my family just adore Dr. Ware because she's treated my whole family for about 8 years. So, and she's absolutely wonderful. And I wanted to ask you some questions about becoming a dentist.
Well, thank you for having me.
Yeah. Why did you want to become a dentist out of all the professions?
That's a great question. My dad was a dentist, and in the summers when I was in junior high school age, I would go and work in his office, and I was around it. I was familiar with it, and I eventually got to learn how to assist. And I just thought, hey, it's a little more fun being on the other side of the chair, and so that's how I got interested in dentistry.
You had told me before you are not the only doctor in your family besides you and your father who's a dentist. This is really cool. If you want to be smarter, you just need to go see Dr. Ware because you feel smart. You're surrounded by doctors. Go ahead and tell us. This is a really, really cool story.
Oh, that's so funny. So after I finished dental school, and then my husband finished graduate school, he got his doctorate in psychology. We moved out here to Maryland and lived with his parents for a short time while we were getting established here. And his father is an MD pathologist. His mother has a doctorate in education. So sometimes when the phone would ring and we'd answer, they'd say, "Is Dr. Ware there?" We'd have to say, "Well, which Dr. Ware do you want?" There's 4 of us. So that was,
Yeah, I love that. We don't have any PhDs in my family. I mean, I could put them there, but they're like, what is that? Well, tell us a little bit about your job. I know you are a dentist, but dentistry has certainly changed from when I was younger, and I would go to the dentist to the way things are done now.
I think the way things are done now is we're very, very conscientious of making it as pleasant experience as it can be. In other words, when you have to have a procedure done, we want to make sure that you're very numb, that you're not feeling anything, and that the patient always feels in control. If they feel like they need us to stop, if they need a break, if they're feeling anything uncomfortable, we totally let them stop us, and we, let them take a break or get them more numb. So I think patients feel a lot more comfortable coming to the dentist than they used to. It used to be a very scared thing, and it still is for some people. That's probably one of the biggest challenges, is to get somebody who is very, very afraid to come in and say, "Hey, this isn't such a bad thing. In fact, it's all right."
Yeah, and it certainly is. There are a lot of guys who are dentists, and then there are going to be a lot of girls who are watching, and girls, they love science and math too. How would you encourage maybe some girls, if they're thinking of possibly going into a medical field, that possibly being a dentist could be right for them?
Yeah, dentistry is great for women. Not only is it good for anyone who likes sciences and math, but you really have to be kind of detail oriented. You have to be very artistic. Some of what we do is very good coordination with your hands, working in a small space. And sometimes women might have a little bit advantage because our hands are a little smaller. It's a good career for women if you also want a family. Your hours are very structured to how you want to work. Some women work part-time, and that's how I started out, was just working 2 days a week when my little ones were infants and then into early elementary school. And eventually I started working full-time and bought my own practice. So there's very many different levels you can take with this career. You can never be a business owner if you don't want to be, or you can have your own business and really kind of direct your own ship.
Tell me about school. You obviously went to high school. What schooling did you have to have after you graduated high school?
Yes, after high school, then you usually do 4 years of college. Your undergraduate degree, many people do it in one of the sciences, biology or chemistry, but you don't have to. But you do have to take some core courses in biology, general chemistry, organic chemistry, physics, different math classes. And then once you've finished all of that degree, you take what's called the DAT, the Dental Aptitude Test, kind of like the MCAT. And depending on what your score is, usually they determine your grades, your DAT scores, and then you're accepted into dental school, which is another 4 years. And when you're done with that, you get your doctorate. And many people will do a residency for a year or two after. Some people will specialize, like an orthodontist has another 2 more years, and they get a master's degree. An oral surgeon usually does at least 4 more years. So that you can stop at the DDS, or if you wanted to specialize, it's at least 2 more years. But it's a lot of school, but it's worth it.
What did you find? How long have you been a dentist?
I graduated in 1990.
Okay.
So it's been a long time.
And out of, since you graduated and to your practice now, what is like craziest thing that ever happened to you as far as being a dentist? Besides my family coming in.
No, your family's great. Oh my goodness, the craziest thing that's ever happened to me. Oh wait, I need to think about this one. There's too many stories and I don't know which one to tell. I think I was working on a little boy. He was probably 5 or 6. And he was perfect. He didn't flinch when we got him numb. I did all kinds of fillings on him. Well, one little bit of some of the material we were working on, he tasted it. And that just set him off. He was okay with getting numb. He was okay with everything else, but he said, that tastes terrible. Fortunately, we were able to just say, okay, well, we promise we won't let that touch your tongue again. And so we were able to finish all that we needed to do. But we just thought it was funny that through all the other stuff that was, many people would say is 10 times worse, that was what he thought was just horrible.
The taste of some of the material.
Yeah.
Love it. Love it. So you talked about the hours that you work.
Mm-hmm.
And I know sometimes maybe compared to an anesthesiologist and things like that, you could have really crazy hours. Yeah. You can actually set your hours.
Right. If you never want to work on the weekends, that's fine. I work 4 days a week, and I kind of have a nice alternating schedule where every other weekend is 4 days. I have Friday, Saturday, Sunday, Monday off. Then I go back to work Tuesday through Friday, and then 2 days off, Saturday, Sunday, and then I work again Monday through Thursday. So it is nice to be able to have a flexible schedule like that. There are some dentists that work 5 days a week. Most work 4. And many work Monday through Thursday and they have Friday off. So it's a nice way to be able to have a good quality of life and spend time with your family and your friends, and yet have a good career.
Well, if somebody wants some more information about being a dentist, what should they be looking at? Maybe if they're Googling something, what should they really look for?
I think they should look for what the requirements are if you're good at sciences and math. I think it would be really good, and I have a lot of patients that do this that are interested in dentistry or hygiene. They're in their high school years or junior high, and they ask if they can shadow us, and we're more than happy to do that. We've had a lot of kids in our practice that have done that, and a few have gone on to become dentists.
Nice.
But I think that's a good way to do it, is talk to your dentist and ask them if it's okay if you could just spend a day watching what they do, because there's nothing like being immersed in what a day is like in an office like that. And that's why I was interested, because I was around it so much. But I think that would be one of the most important things, is to spend time with people. You're a dentist, and I'm happy to have any kid who wants to give me a call to spend a morning or a day with us. That's fine.
Wonderful. And you're certainly going to want to get to know Dr. Ware if you're thinking about possibly pursuing a career in dentistry. Beautiful office on Thomas Johnson Drive. So we want to thank you for doing this career fair with us.
It's been a pleasure.
Yeah, and it's always a wonderful experience every time we go in, always. And we really don't get laughing gas. So, it's just a naturally great experience with Dr. Ware.
Although we do have it for patients who really want it. We do have it.
Yes. Thanks for coming in.
Thanks for having me.